Thank you for staying tuned. As we promised, tonight we'll be focusing on the elderly persons because it is the International Day for Elderly Persons as designated by United Nations. We're having Jude Otogo, who is the health coordinator in Help Age International. Welcome, Mr. Jude.
Thank you for having me.
All right. It is the 30th celebration when it comes to International Day for Elderly Persons. Kindly tell us why is there the essence to celebrate this particular day?
Thank you. Probably I should start by clarifying who an older person is. An older person is anyone aged 60 and above. That is the UN definition of older persons. As you rightly observed, this is the 30th anniversary of the UN International Day of Older Persons. It is celebrated to basically acknowledge or highlight the contribution that older persons have made in society, but also kind of highlight issues that affect older persons. I'm specifically pointing out those two issues, the contribution of older persons, contrary to the assertion that older persons are frail and useless in society. That's not true. If you look at older persons, let's take the context of our country. They contribute a lot.
Yeah, they do.
Listening to the bulletin, you highlighted the case in Kibra, where one of the older persons cited that her children had passed on, leaving her with a number of children to take care of. That's a big contribution. Older persons engage in a lot of entrepreneurial activities and other economic activities. They're the custodians of culture, which is really the mesh of the social fabric. Yeah. So there's a lot that older people do. But on the flip side, they also have quite a number of issues that are worth highlighting. There are rights and freedoms that are not being fully realized.
Yeah.
It's critical. They undergo what we call ageism, which is discrimination based on age, and many other issues. So these are the issues that this day seeks to bring to the fore for interrogation and possible consideration for resolution.
Now, looking at it, normally, traditionally, I know we are in the digital era, but traditionally we used to really respect and look after the elderly persons because they were seen as people who used to transmit culture from one generation to the next. But over time, there has been a change of the way we do things. Of course, they say it is a new age. Sometimes it is a new age. But therefore, it brings the aspect of now the younger generation not really taking care of the elderly persons. Do you think as a nation we have castigated or left behind the elderly persons?
That's a good question. True. Older persons used to be taken care of by society, by family members. But we should also be cognizant of the fact that a lot of things have changed. Most of the people that used to take care of older persons, that is women and girls, are moving out of the homes, the rural homes, to seek economic opportunities, to seek academic opportunities, look for means of livelihood, and therefore leaving older persons back in the village.
Yeah.
So it is true that with technological advances and economic pressures, the older persons have relatively been consigned to the rear, or rather not in the mainstream. As a country, then we want to ask ourselves, how do we mitigate the continued neglect of older persons? Yeah, and it is time we got into that conversation to find a solution to be able to support older persons.
All right. Now, let us bring the discussion closer to what we are facing at the moment, and that will be the COVID-19 pandemic. Although right now the government has sort of eased the measures, But before that, there were stricter measures such that Nairobi County was sort of, locked down, so to speak, and therefore people could not go to visit their parents or the elderly persons, and therefore there was an aspect of isolation. And some psychiatrists or health experts sort of said that the elderly people are facing loneliness, some are facing depression. Do you think this time of the pandemic they were really quite affected?
True. Truth be said, I think older persons have been the hardest hit segment of the population. And not just by way of isolation, but there are other impacts of COVID-19 that have hit the older person hard. True, with containment measures and restriction of movement, definitely older persons were concerned into isolation. Because relatives couldn't visit, they couldn't leave to go and visit relatives and other social support structures. That's one. Secondly, in terms of livelihoods, older persons depend a lot on remittances from their relatives and children. And we all know that the pandemic caused job losses, closure of businesses, which means reducing the remittances that older persons used to enjoy. And looked from a broader perspective, it would then mean that their nutritional needs are not met, their health needs are not met, because they need money to be able to afford healthcare, to be able to afford food, and meet other needs that they have. In fact, somebody said that let's prepare for the second pandemic, referring to the mental and psychosocial issues.
Yeah, that's true.
As a result of the COVID-19 containment measures. But at the most immediate is the direct impact of COVID-19. Because of the low immunity of older persons, they were at a greater risk of contracting the virus, at a greater risk of suffering from the severe forms of the disease, and unfortunately, dying from the disease when they contract it. And so, in fact, the statistics indicate that up to 40% of the deaths from COVID were among people aged 60 and above. Yet, there were probably just about 15 or 10% of those that were infected. So you can see how they were disproportionately affected.
That's quite true. You put it into a perspective. Jude, you are a health program coordinator, and therefore you know aspects concerning healthcare system. We know as we grow old, our immune system gets beaten due to environmental challenges, due to whatever we are facing at the moment. But do you think our healthcare system has been able to take care of the elderly persons? And in this, I want you to put into the aspect of the NHIF we have, the universal health coverage. Has it been able to really take care of this particular special group?
Efforts are being made. Let's not deny that fact. But it is far short of the need for older persons' health requirements. Why do I say this? When you talk of a health system, for us to say that it is sufficiently meeting the requirements, health requirements of a given segment of the population, there are things that we look at. First of all, we want to look at the health workforce. Do we have a skilled workforce to be able to address the unique health needs of older persons? The answer is probably no in the context of our country. Because in this country, and generally in the continent, we have very few healthcare providers that are specialized in providing services for older persons. This country may just be having 2 or so geriatricians. We don't have geriatric nurses, we don't have lower cadres of healthcare providers that are specialized in taking care of older persons. The second aspect of a health system that would define efficiency and effectiveness is the supplies and technologies. Do we have medicines necessary to respond to the health needs of older persons? We all know that as we age, we become more amenable to non-communicable diseases. The diabetes, that is high blood sugar, or fluctuant blood sugars, high blood pressure, cancers, and the like. These are conditions that can be managed long term. but do we have the necessary supplies for diagnosis, for management of these conditions? The third aspect that I would like to highlight about the health system is what we call leadership and governance, which is mostly about a structure, a government or a public structure that prioritizes health needs of older persons. Do we have the right legislative framework, policies, programs in place? Again, the answer is no. We look at the data. How do we even plan for the health needs of older persons if we do not have data that is disaggregated by age? There are no two similar old persons or two same older persons. A 60-year-old person may be as resilient as a 30-year-old, while another 60-year-old person may be so frail. So if we do not have data on sex and disability, it would be very difficult to plan for the health of older persons. So to answer your question, yes, we are trying, but it's important that we up our game in terms of having skilled health workforce, in terms of allocating funds to health programs for older persons, in terms of ensuring adequate supplies in medicines and other technologies necessary for diagnosis, management of conditions for older persons, in terms of having the right legislative framework in place, and of course having a robust health management information system in place.
All right. Now, our reporter, Grace Josephine, did a story concerning the issue of cash transfer program. It is a program that started in 2017. And therefore, how successful has the program been for you? From what you witness in the ground, it is a social pension scheme. Do you think it has been really successful, given that some elderly persons have come out to lament that they do not receive that particular fund?
First, I should laud our President, His Excellency Uhuru Muigai Kenyatta, for having made a decree that older persons aged 70 and above should enjoy some universal pension in form of cash disbursements to the tune of 2,000 shillings per month. In fact, that program, that is the Inua Jamii 70 Plus, has acted as a template for the region. A number of countries are now learning from us. But having said that, definitely with every system that's just taking off, there will be challenges. Indeed, it's true that due to administrative and system challenges, some older persons may not access that money in time or not at all. But on the positive side, out of a possible 1.2 million older persons, 833,000 are already accessing these funds, albeit with challenges. And HelpAge is working closely with the Ministry of Labour and Social Protection to come up with innovations that will ensure equitable and efficient access to these funds through a project that's funded by the French Development Agency, AFD. Today we are also launching a report, a baseline report on the same that was done in 3 counties, I think, Muranga, Bungoma, and I can't remember the third one. Just looking at the impact of Inua Jamii 70 Plus on the lives of older persons. More evaluations will be done over time to see how this program is impacting on older persons. And yes, there are challenges, but it's in the positive direction that we already have such a program in place.
But there has been the concern that maybe the money is too little. Some have said they receive 1,000, others say they receive 2,000. So it is sort of varied. There isn't really a static measure. And even if there was really a static measure, the money, 2,000 shillings, yes, it is really a pension scheme, but in this economy, some might say 2,000 shillings is too little, given that there is no proper healthcare system, given that the economy is quite beaten down. Do you think the money should be topped up to sort of create an impact as it is?
Yes, it is little, but better than nothing. We all know the cost of living in this country is not low.
Yeah.
The best would be to step up that amount to a figure that is slightly above the the threshold for life below poverty level. If it could be pushed to at least, is it $1 per day or
Yeah.
higher, it would be better. That would bring it probably to $30 per month. But we have to contend with what is available, and continue advocating with the government that more resources are assigned or allocated for this very, very useful program for the older persons.
Right. Now, here in the country, we have the rural to urban migration, and as we have talked, a lot of young people moving from the rural areas to the urban areas, and therefore it comes to the aspect whereby the elderly persons, they have nobody to take care of them. And if you look into developed countries, they have created a care homes, or some have termed it the destitute homes. Here in Kenya, have we really embraced that way of really taking care of the elderly persons? How has it been, the uptake, has it been quite fast?
Again, thank you for that question. Our context is relatively different from the Western countries. We are more social.
All right.
Okay. And taking a parent to an older people's home
Yeah.
is like neglecting them. That's the traditional understanding of a care home. But again, we have realities. Realities of a demanding economy, a monetized economy, where you have to go out and find something to eat, something to survive on.
Yeah.
And they cannot sit at home and take care of their older folk.
Yeah.
So the question that begs is, how do we reconcile the realities of the day and the needs of the older persons for care? In Kenya currently, there are not many older people's homes. The few that are there are run by faith-based organizations. Probably one or two may be run by county governments, especially in Nairobi, and the private ones are quite expensive. So majority of older persons that would have benefited constrained by two things. Fewer facilities,
All right.
and two, the cost of maintaining an older person in a private older person's home. So we are still far away, and there is need for us to start having this conversation to reconcile the realities of the day vis-a-vis the past.
Yeah. All right. Now, in developed countries, of course, we cannot compare ourselves to developed countries, but here in Kenya, there have been the cries that the security of these specialized groups has not been quite looked into, or has not been quite focused on, because we've had cases of elderly persons being raped because they are vulnerable. We have cases of elderly persons being mugged, and therefore it has been a concern that maybe the government has not legalized laws to look into this particular special group. As a non-governmental organization, have you sort of seen this happen? Is it something that you think the government should be keen on moving forward?
Every individual has the right to safety and security. Older persons are no exception. It is true that we have had cases, even in the media, of older persons being abused, older persons being disinherited of their property. There are parts in this country where older persons are characterized as evil or witches, and they are lynched.
Yeah.
Besides the common law that protects every individual against abuse, there is probably no special law that protects older persons.
All right.
And so there is definitely a hiatus that needs to be plugged in terms of putting in place legislation for the safety and security of older persons. We continue advocating as Help Age International for the safety of older persons, for the security of older persons. It is something that we are conversing with even parliamentarians or
Right.
legislators to see how they can come up with comprehensive legislation to address the rights and freedoms of older persons.
All right. Now, talking about legislation there, Jude, that will be my second, my next question, sorry. Looking at the House of Parliament here in Kenya and looking at the laws and the policies that have been put in place to cushion or sort of protect this particular group, do you think the Legislative House has done enough? And do you think there has been really focus in terms of implementation of these particular laws and policies?
Probably yes and no.
All right.
Yes, because our constitution is very rich and provides for universal rights and freedoms. I would like to single out an act of parliament, that is the Social Assistance Act of 2013, I think, which is now being considered for repeal, to set up a fund for cash transfers to older persons. But social assistance is not limited to cash transfers.
Yeah.
There are other forms of social protection and social assistance. The 2013 Act stipulates who is eligible for social assistance. Yeah. It stipulates the criteria for those that should benefit. It proposes a council to coordinate and oversight all forms of social assistance. Social assistance includes preventive measures, protective measures, rehabilitative measures. So limiting the proposed repeal in limiting social assistance to
Cash
funds,
transfer, yeah.
to cash transfers, is really not right. It's not fair.
All right.
So we have not really put in place the right legislative framework to support older persons in this country.
All right.
And again, I would like to just mention, I think it's the women rep for Kimbo Mwashomba.
Gavani Mushombo, yeah.
Yes. She's drafting a bill that she intends to push through, and it's a beautiful, beautiful bill. I would urge anyone that has the means and ability to support it to push it through.
All right.
It would be a big step for the older persons of this country.
Okay.
And then bill goes through.
All right. So if you could kindly elaborate what the bill encompasses, what are some of the issues that the Kiambu Women Representative is pushing for in that particular bill that will really change the situation moving forward?
It is, as I said, it's very elaborate and comprehensive, looking at issues of health,
All right.
long-term care, social assistance, non-discrimination of older persons, which is quite rampant, and many other aspects that older persons face in this country.
All right.
Yeah.
I know the bill, maybe it might be in the works, maybe during public participation, then it will be open to the public. Now, because now we are pressed on time, kindly give us your parting shot. Looking in analysis, what is happening, what you're advocating for as Help Age International, and what you like to see next year as we celebrate the 31st International Day for the Elderly Persons.
Thank you. I started by saying that this day is also about reflecting on the issues affecting older persons. And one of the issues, I didn't mention that we are also celebrating the commencement of the decade of healthy aging.
All right.
Yeah. And for older persons to make meaningful contribution and exploit opportunities in old age, they must be healthy. One of the areas that really older persons are having challenges with is health. Gratefully, the presidential decree included having an NHIF integrated into the Inua Jamii program, such that every older person that's accessing Inua Jamii or that's registered under the Inua Jamii program also has an NHIF cover.
Right.
That was a big step. Unfortunately, only about 5% of those that are eligible are enjoying that integrated cover.
Right.
For the sake of older persons, when we hit 60, we are most likely retiring from active employment, okay?
Yeah, sure.
Our employer will not cover our medical needs. Private insurers rarely want to insure people age 60 and above. And if they have to, one has to pay a premium. My appeal would be for government to possibly have an NHIF cover for older persons, for the husband and wife,
Right.
or if they are single, for them to enjoy NHIF cover throughout their lives,
All right.
non-contributory NHIF cover. That's one of the things I'd like to see. Secondly, it would be great to hear this time next year that all older persons, the 1.2 million older persons, are enjoying equitable and efficient access to the Inua Jamii funds. And thirdly and finally, it would also be good to realize an increase in the amount that's disbursed to older persons. As Halpage, we are working with the national government,
Right.
Ministry of Social Protection, Ministry of Labour and Social Protection, and Ministry of Health, to facilitate realization and enjoyment of older people's rights in this country, in the continents, and globally.
All right.
Thank you.
Thank you so much, Mr. Jude Otogo, of course, for giving us perspective of what should be done for this special group that some have said have been marginalized for a period of time. We're really grateful for making time.
You're welcome. Thank you.
All right. That has been Jude Otogo, who is the Health Program Coordinator in Help Age International, talking about the elderly persons, what should be done, what the government is doing, and where we need to improve. We're taking a short break, but we'll be back with more. Do stay tuned.